Welcome to the Engage, Arrive and Call webinar, The Future of Patient Check-in. Joining you today is me, Donna Brabbin. I'm Senior NHS Partnerships Manager. And on the call with me, I have Anna Hayhoe.
Hi.
Give us a wave, Anna.
Hi.
Anna is the Training and Implementation Lead. And we have Emma White also on the call. Emma, can you give us a wave?
Did you see?
Not quite, but we can hear you. Thanks for joining, Emma. And Emma is the Engage Suite product owner. Now, Anna and Emma will both be here to support on questions throughout the webinar. If there is anything you'd like to ask, go ahead and pop it in the chat. It will be answered as we go along, and we'll highlight some of the key questions at the end. But we'd love you to join us on our virtual tour of Engage, Arrive and Engage Call. But first of all, I'd like to run through our background. Well, Engage Health Systems have been providing patient check-in solutions for 20 years with Engage Touch. And across England, Scotland and Wales, we have almost 2,000 customers using one of our solutions, triage, patient messaging or check-in. And as a trusted supplier to the NHS, patient safety is at the forefront of everything we do, which is why we maintain the clinical safety standard DCB 0129. We uphold 3 ISO certifications and we're Cyber Essentials and Cyber Essentials Plus accredited. But what problems do we solve? Well, we've now completely revamped the check-in solution and taken the opportunity to build Engage Arrive on the latest technology, giving us the power to enhance the service, provide improved support and address the budget challenges in the NHS. And with patient demand at an all-time high this winter, we understand that many practices are having to put their reception teams under immense pressure, with patient check-in seen as a luxury that is out of reach for most in the current climate. Until now, with our new solutions, we've not only revamped our patient check-in to bring you Engage Arrive, but we're making use of the patient's time whilst they wait for their appointment by asking custom coded questions on their mobile device. We've also added Engage Call, which with Engage is no longer a nice to have if you have the budget, but now an affordable luxury that is available to practices with any budget. And all Engage solutions now follow the NHS design manual. So as well as being secure, accessible and inclusive, they're also intuitive for the user and patients and super affordable. So let's start by showing you some of the services, and we'll begin by showing you Engage Arrive. This is our basic check-in service. So I'm going to blow this up for you so you can see it a little better. Now, before I start, I will point out that patients can check in with any language, and we'll show you that here, how the patient can select any language, and if they don't see one, they can hit the More button. But we'll go ahead in English today. And the patient can scan the QR code and check in using their mobile phone if they'd prefer not to use the screen, as we know some won't since the pandemic. But we'll go ahead and hit start, where the patient would see an optional custom message that you've set in the settings, but we'll continue. And the patient can select the day of birth. And I will say this video has been slowed down to half speed. They can select month of birth and the first letter of their last name. And the system will look for the patient's appointment in the appointment book in the clinical system. And yep, we can confirm this is Jenny Johnson. and then the patient will be marked as arrived in the appointment book, and they'll get this message. So just to pause it here for a second, you can see that it's very clear to the patient they've been marked as arrived, and they can take a seat in the waiting area 2, which is located downstairs on the left-hand side, which gives you the opportunity to name your waiting area and give the patients a bit of a helping hand so they know where to go. You can also see this option. Your GP wants you to complete a questionnaire. This is an add-on to the Engage Arrive service, which is called Custom Coded Questions. And it will display a QR code where the patient can point their smartphone camera to the QR code and be directed to answer custom coded questions on their mobile phone whilst they're waiting for their appointment once they've been marked as arrived. So I'm going to show you that in a second, but I just want to point out this last thing, finish button there. The patients don't have to select the finish button. If they don't hit finish, it will go back to the original screen. So what we'll do now is we'll show you the custom coded questions feature and how that works, which is just down here. So the patient will go ahead and point their smartphone camera at the QR code once they've checked in. They'll then be directed to this mobile format questionnaire, but they'd need to enter their date of birth, 17/01/1957, and submit. And then they can start the questionnaire, which is a smoking status one. And they can put the answers in. And this option to asking for a telephone number and if there's anything they'd like to add, that's if you choose to review the answers first. We'll ask these questions. But if you choose not to review the questions and you want them to go straight into the patient's record with the clinical codes, we won't ask those questions, they'll be hidden, keeping it nice and simple. So that's the custom coded questions. It'll be the same for every patient. And you can ask any question. You can use one of our pre-built questionnaires, or you can create your own, and we'll give you the option to build your own with all the clinical codes you need. And the questions are not limited in any way. So you could ask as many questions or as few as you like. But I will move on now to show you the Engage Arrive settings. Let's blow this up so you can see it. Now you'll be given, with Engage Arrive, you'll be given 3 settings: appointment arrivals, mobile, and touch screens. If you opt to add the custom coded questions feature, you will also get this option here, questionnaires, and that's where you can build your own questionnaire to use. But let's go ahead and start the video. So in the general settings, you can set the early and late arrival window. And we think a good option would be 60 minutes early, 5 minutes late, but it's up to you. You can also customize the waiting areas. So you can create your own. You can add the instructions display to the patient so they know where to go. As you can see, you can add multiple waiting areas if you have various places. And consulting staff, we hit this button on the right and it will pull through your consulting staff where you can select one and you can allocate them to a particular waiting area. And you can also set different waiting areas. So I'll show you that. You can just scroll down and select the days. It might vary across the week. You can select the waiting area in a particular time frame and then change it if it's different later in the day. And the custom coded questions feature, this is where you'd be able to grab the questionnaire that we've built or you've built yourself. So we've got that set to medication review, and you can tick the box to say that responses do not need to be reviewed, in which case we won't ask them to upload a file, we won't ask them if there's anything else to add. The questions will just go straight into the record with the codes that you've added. And if they untick the box, we'll give you a little requests option where you can review them in a little inbox, and you'd be able to allocate them to another user, or you would be able to add the questionnaire to clinical once you've reviewed it first. So it will go into EMIS, System 1, Vision. What we'll do is we will play the rest of the video and I'll show you the mobile setting. Now, any patient that hasn't downloaded our free Engage app will be able to check in using the Arrive tab at the bottom. So they'd be able to arrive for their appointment using the Engage app. It is free to download and use. Or you could have this URL, which is unique to your practice, put on any text message reminders that you send and say, don't forget your appointment tomorrow. Please use this link to check in for your appointment when you arrive at the practice. Or you could put it on a QR code and a poster, maybe have that on the front door, and it just saves you money because you don't have to have additional screens. You can use the mobile option alongside your screen version. And you can see here that you can enter an information message which would display on the patient's mobile as well. And I'll continue the video now. And you can disable it if you want to, so easily enabled and disabled. And here you can see how you can use a pin drop to pinpoint the location of your practice using the what 3 words. And you can also set a check-in distance, which ranges from 10 meters to 100 meters. So you might want to allow some patients to check in from the car park. For example, if your practice is very small and you're having a flu clinic, you might want to extend the distance out a little. Or if you have patients that are very frail or and may need to check in from the car park before they make their way in, then you can do that. And then we have the touch screens option, which is really easy. To link up a touch screen to the service, you just have a 4-digit code on your screen. You'd pop it in here and that would get the software and the screen talking to each other. Okay, so what we'll do now is show you our newest service, which we're really pleased to introduce, and this is Engage Call. And if I blow this up for you, you'll see that we will give you access to the Engage toolbar, which is connected to the Engage client I've shown you. And what we do is just hit the Call Patient option, and it will bring up for that particular user the patients that clinician is due to see that have already checked in for their appointment. And you can see there if the clinician selects one of the patients, this will send a push notification to the Engage app for those that have downloaded it. Or if you would like to purchase a low-cost Android TV to use as a call board, you can use this to call patients through on a screen. And I'm going to show you what that would look like with your screen. So let me go to that. It's lovely and clear. You know, the patient is being called to their doctor at the particular room. Now, let's recap on everything that I've shown you today. You've seen an intuitive interface with NHS Design, where patients can check in using any language and can choose from a mobile or screen-based check-in. And you've seen how you can customize patient-facing messages, create personalized waiting areas, and easily adjust the settings to work for you. and how you can make use of patients' time while they wait and maximise QoF point potential by using a QR code, which you can direct patients to answer custom coded questions on their mobile device. And you can decide to put the responses straight into the patient's record or review them first from an inbox. And you've seen Engage Call, where you can call patients that have arrived for their appointment through to their consultation with an Engage app push notification or a compatible low-cost Android TV. But you might decide to use these services with your existing hardware, which is absolutely fine. If you've got hardware to use, we can install our software on that, but you might decide you need to update your hardware, in which case we can provide a couple of screen options for your check-in service, which is one is a 15.6 Android tablet. Using an Android tablet makes this much more affordable. You can avoid the expense of future Windows upgrades. She won't have to worry about that on the Android side. The screens we provide are a tablet fitted to the wall. They're commercial grade, built for high demand, built to last, and they come with a 12-month manufacturer's warranty, but they should last you a long time. And the other option, if you'd prefer to have a Windows screen, is our premium 19-inch Windows 11 screen. We've been building these in-house for 20 years, so they do the trick. They last really, really well. And because we build them in-house, we're able to give you a lifetime warranty on the screen itself. Now, I guess you're wondering how much all of this costs. And just to go back to the beginning, the basic check-in software is £249 plus VAT per annum, and that's without the custom coded questions feature. This will work with any screen, but you might decide to buy a screen from us to go with it, like I've shown you. If you want to add the custom coded questions feature, the total cost would be £348 because we're adding £99 for that additional feature. So that's £348 per annum, per screen on a rolling 12-month contract. And that includes the ability to maximise your QoF point potential. And we also have the option, if you purchase Engage Arrive before the end of March next year, we will give you the Engage Call software free of charge for 12 months. Now, after that 12 months, it's only going to be £99. So we're not going to be charging you through the earth after the trial period, as some do. But what I will say is this will free up the budget so that you can buy that low-cost call board to go with it. We're not planning on providing call boards. You can also see the screen cost down the bottom here. Of course, if you can't see this working with your existing screens, which for whatever reason, it might be due for an upgrade, it might be very old, then you can buy a screen from us. So the 19-inch Windows is £1499 with a lifetime warranty, or the 15.6 Android is £710. And of course, those are one-off costs. But thank you. I'm sure I've seen the chat box keep popping up. I'm sure there's lots of questions in there. Emma, is there anything interesting I can share?
Yep, so we've got one question from Wayne. Does the Engage agent need to be permanently on? For multi-site practices, would that need to be at all sites? So yes, it does need to be running for Arrive to work. So anytime you're using the screen, it would need to be on. And for multi-sites, you would have to have the agent running at each site. So I hope that answers your question, Wayne. We've had some other questions in the chat that Emma has answered, and we've got another one from a customer around their ICB has purchased screens on their behalf, and they want to know if they can just purchase the software for them.
Yep, absolutely. We have got the service placed into modules so that it's your choice. You do not have to purchase screens from us. You can purchase the software to go with your existing hardware, no problem at all.
Perfect. And Daniel has asked, is it possible to get a copy of the costings sent by email?
Of course it is, Daniel.
Brilliant. Is there any more questions from anyone? You can either say them or pop them in the chat and we'll answer them. We did have one earlier in case anyone missed it from Wayne. Does the management console still need to be installed on individual PCs or can it be accessed from anywhere? Which Emma did answer in the chat. So the management console is accessed via the Engage client, which is also available via any web browser. And the Engage Arrive does require the Engage agent application to be installed at least one PC in the practice.
Thanks, Anna. Is there anything else?
Sorry, we do have some more questions in the chat.
Okay.
So can the agent run on the touch screen?
I'll take that one. No, it doesn't. To keep it secure, it's on a PC on the practice network that has that connection to the clinical system.
Perfect, thank you, Emma. And we've also got a question from Judith. If we have 2 sites, is it double the cost?
If you have 2 sites, the software itself is per screen. So wherever you need a screen, wherever you have a screen, yes, you would need to pay for individual software.
Perfect, thank you, Donna. I hope that answers your question, Judith. We also have a question from Kerry. So they've said they have an MJOG screen. Will it work with that?
An MJOG screen.
So basically, if we're talking about Engage Arrive, it's running on a web browser. So any device with a web browser, as long as it's, up to date, it will run.
Oh, so I think, are you speaking about you have MJOG on that particular PC, and will it run on a PC where MJOG is installed? I think that.
Oh, sorry, they have put, sorry, ignore that. Another question we have in the chat. We have an Engage Touch. Is this package or software compatible with this? So they already have Engage Touch.
Well, if you have Engage Touch, we will be migrating you over to Engage Arrive at some point. So we can, and if you have a screen with us already, we'll be able to migrate you over to Engage Arrive. And we're preparing to do that. So please do be patient with us. We will be pushing a button soon and we'll be giving you plenty of notice.
Perfect. And I believe this one's for Emma. The questionnaires that go with Engage Arrive, are there plans in place to be able to answer questions on the touchscreen or just using a mobile phone?
Yes. So we've got lots of plans for the future, but on the immediate roadmap, we know the 2 things that are most important to practices is checking patients' details and vaccination reminders. So they'll be the first things that come. Targeted questions will be coming later. But that is something that is already available in our messaging module, should you be interested in that.
Perfect, thank you. Another question in the chat. So this one is from Katie. We are looking at it from a PCM perspective. 5 practices, multi-sites. Would there be any bulk buying costs that could be negotiated?
We can certainly have a look. So yeah, if we have it, take this offline, we can have a chat about that.
Yeah, we'll reach out to you, Katie. This has been recorded as well, so you will receive the recording of this webinar today as well if you needed to check any details. We have a question come in from Judith. We have 2 TV screens with the current call-in system, one of which is a smart TV, the other one isn't. Can the smart TV be used with a browser, please?
So how it works is the patient call system is an Android app. So if it's an Android smart TV, you just download the patient call app. And if it's not, you just need to purchase an Android TV stick, and we'll be able to give you some advice on a suitable one. But basically, any TV with an HDMI port, I believe, will run one of those sticks.
Perfect. Thank you, Emma. Oh, another question. Is there an email address where we can send any further questions we may have later, please? Of course there is. So get them sent over to sales@engagehealth.uk would be great. I'll pop it in the chat for you.
And if you do want to message me directly, my email's on the screen here. And if you'd like to book a meeting to discuss it further, you can use the QR code to book yourself in. So do feel free to use that if you want to.
Perfect. Another question's just popped up in the chat. Is the patient check-in via mobile configurable enough to only let them book in once they're inside the actual building?
Yes. So you set the area in which a patient is allowed to check in. So you can restrict that to your actual building, or you can extend it to, for example, your car park if you want to allow people to wait in their cars before their appointment. Once they have checked in and they're marked arrived on the clinical system, it would not find them again if they try to check in again.
And all these settings are so easy to do in that management console. You can change at any time, click save, and it will update it automatically and instantly. Any more questions for the call? Thank you for all the questions so far. It's been really great to have you all interact with us today, and thank you all for joining the call. Any more burning questions before the call ends? No, I think that could be it.
Well, thanks so much, everyone, and thanks for your contribution. It's been really great showing off the services today, and we wish you all a fantastic afternoon.
Yeah, thank you, everyone.
Thank you. Take care.